Have you been wondering about a symptom or your health and you weren't sure where to go next or what is happening? That's what we're going to be talking about today. Welcome to Women Leaders on the Move, a Her C-Suite radio podcast. I'm your host, Natalie Benamou, and every week I learn right along with you from amazing speakers on this show. I'm also the founder of Her C-Suite, a portfolio career network where we help women define and build what's next. And I'm the CEO and founder of Her Health X, and we are going to be talking all things women's health today. And I would love it if you would visit herhealthx.org to learn more about the programs we're launching this year. Speaking of launching, I can't wait to have this conversation with Dr. Sarah Berg. She's a board-certified OBGYN and menopause specialist. We talk all about the important work that she's doing and how you can learn from her. Let's get started with this conversation now. Dr. Berg, I'm so excited to welcome you to Women Leaders on the Move today. Thanks for being on the show.
Oh my gosh, thank you so much for having me. I have been excited to be here.
I have too, because the topic is going to help our listeners in so many ways. And I can't wait for them to hear what we're going to share. But before we get started, I would love to have a snapshot of you and what got you doing the work that you're doing now and being so passionate about this topic in particular.
So I am an OBGYN and menopause practitioner, and I was in the clinic for over a decade working with women. Of course, women of all spectrum. So from the 11-year-old first period all the way to end of life information for women. But what I found was that my midlife, so perimenopause, menopause, postmenopause women were coming in and they had the same expression. And I call it the slump shouldered expression. They had been someone that radiated positivity. They were the top of their career. And then they came in and they were like this. And it's almost like I felt like I had to draw out of them what was going on. And I was hearing the same story over and over. And it's probably the same story a lot of your listeners feel internally, and they maybe haven't been able to share it with their physician or even the people they love in their life, but they felt like they were losing it, or they felt like where they had been and what they had been doing, they weren't capable of doing that anymore. And they thought, how can I keep going because I'm not at my peak anymore? And what I realized is the lack of education of what was coming had led them to feel alone and isolated and shameful, where when really this is a transition that once their body adjusts, they are themselves are better on the other side of it. And I wanted to bring that message to a bigger audience so that more people could feel like they had understand what was going on rather than feeling like they were alone.
I think that this time of life can be so isolating and you do feel alone and you do wonder because we're complex and menopause isn't just, people think a hot flash, that's it. No, it's your heart, it's your hip, it's like all these different things that I had a doctor tell me. She's like, oh, hip pain can be, menopause. I'm like, what are you talking to me about? I had no idea because I run and I've got this pain on my hip sometimes. I'm like, what is that? It's just arthritis. No, I would love to start with this idea of where should we start to know what to recognize, whether you're perimenopause, wherever you are in the seasons, what's some things to start to look for or know and recognize what's happening?
That is a great question because I feel like people end up waiting until they've been going through it for years, if not decades. And so the where do we start question, and I think it's the idea that we look at menopause and we see people portrayed in menopause as being elderly. So when we see a presentation in the media or on a book cover, they're beautifully grayed haired. They have their array of wrinkles. There is a look that's portrayed. But you and I are menopausal, postmenopausal, perimenopausal. So we have to redirect the look. It doesn't look the way the media shows us. And I hope more and more women feel comfortable saying these symptoms are happening so we can present this younger, because this is a midlife problem, not an end of life problem. And then we have to get educated. We have to learn about what's happening, just like we did when we went through menarche or starting our periods. we've got to learn what's going to happen so we have the expectation and understanding that this is a whole body issue. And I love how you said that. You said people think hot flashes, a little bit of that. Like you said, this could be hip pain. This can be heart issues. This could be osteoporosis. This could be your brain not working the way. And so a lot of patients think they have dementia when it's actually just the buffering of the estrogen receptor changes. So it's skin changes. It's all sorts of hair loss. Oh gosh, I can list for days. But if you didn't know, you would think that these are all separate issues and you are falling apart.
And it's that sense of falling apart, and it doesn't all happen at once. So you could have hip issues because, like, right now I'm standing here and I'm like, oh, my hip is bothering me right now. But it's one thing, and it could be two things at a time. It could be one thing. And so when you go to a doctor, let's just say it's your heart, and you think, okay, I'm going to go to the doctor for my heart, when actually it's related to menopause, but you're going to the specialist that you think is in that lane instead of someone like yourself who's like, no, it's all these things and connecting the dots. What can we do to find someone? Because you are amazing and you understand this, but I've heard, and you can correct me if I'm wrong, that menopause is really almost like an afterthought or perimenopause in terms of what people are trained on, even as physicians. And so it's a learning on both sides.
Absolutely. And I love that you said it that way because I think part of the problem is that both sides need the educational backup. I am an obstetrician and gynecologist. I specialize in taking care of women. But when I learned in training in medical school and residency was a lot more focused on the surgeries I was going to be performing and the babies I was going to deliver and the very common bacterial infections that I was going to see in the office. I think I had maybe 1 or 2 hours period throughout 4 years of training where I was going 80 hours a week of learning and doing on menopause. And that's classic. And this is someone who is specializing in women's care. So if you can imagine that, other fields have even less information about menopause. And we are working to change that. There's a lot of organizations that we are trying to make that different, but you have to go in knowing that your doctor wasn't given the time and training to maybe be the expert on it. And so to be an expert on it, I took time and I did it on my own. I went and took this menopause practitioner certification. It's a course and I keep it up just like any credentialing. And I have to do extra learning every year. And I, of course, pay my money to make sure that they know that I'm involved. But I did that because I was so fascinated by this disconnect that I wanted to learn. And so I feel like that's a great place to go if you want to find people that are that interested in knowing how to take care of you. Menopause Society has a list of people who took the certification, and they are all over the country. So that way, you know someone in your area, or if they work for telemed, someone that you can go to for telemed. So if you live somewhere rurally and you're worried about how far it was going to take you to see that doctor, there's usually a telemed location you can go to where they can talk with you about this and they can be as up to date as possible.
I'm thinking because I was in trade shows for my career and did all the medical shows. I did ACOG, AUA, like interestingly, AUA, which is the American Urological Association. You would think that there would be a balance, but it was actually disproportionate because that is the air quote male doctor that typically ends up seeing men. And so there wasn't really a whole lot of education even in those environments, but I'm just wondering about the conferences and how to get more cross-functional with, American AAFP, I think it's American Family Practitioners or something like that. Like how do you see what you're doing, cuz you're doing education, getting out there more broadly so that a cardiologist or so that a family physician can understand what's happening? Because if you only had 2 hours, you're right, they probably had 15 minutes. I don't know, I'm making that up, but a very short amount of time.
Well, that is something I'm working on, and we're working on women's health advocacy is working to try to get that into the schooling system so that it's part of their curriculum. But also, what we can do now is, I mean, the more you know as a patient, the more you take the time to be educated on what's going on in the body, the more that's going to push your physician to be on board or ahead of where you are because they want to be the medical specialist for you. They want to know what they can do to help you. I always say, you don't know what you don't know. They might not know what they don't know. So if you can cross that boundary, that might be a great starting point in the interim while we work on making this a bigger public health issue and making sure that education gets pulled into the doctors that are coming up. Because there is a good 30 years of doctors that learned almost nothing about menopause. And we're all out there and we want to care for you. We just need a little help. You, as a patient, can be the help for the doctor. Or if you're a doctor listening to this, you can now say, hey, I didn't even know that this was a thing, and let me see what I can do. And again, I understand we are busy people. There's a lot that we already have to know. But if it's something that you feel like you could help yourself or your patient, I think we would all try to do that.
And one of the things we were talking about earlier is about the workplace. And whether you're a solopreneur, a business owner, or you're in a company, it does impact whether it's fatigue, brain fog, all the different things that can happen in meetings, whether, the stereotypical thing that does happen where you start to just all of a sudden get really hot and have a hot flash, to really having trouble remembering something important. And then it's embarrassing to the person because you're like, I knew that. I walked in and I could not remember. What are some things that you're doing to educate the workplace to help with empathy and understanding? Because I think that's really important.
Thank you for asking because that's something that I'm very excited about because I feel like this will be, and what I'm going to talk about is something that will help not only the woman, but it'll be the corporation around them to retain the woman. And so I'm starting an initiative called Menopause at Work, where my goal is to bring in not just a lunch and learn, a one time event, but a long term program that really hits at the C suite level, at the HR manager level, and the employee level of educating the company on what's going on with women during their highest potential for moving up. So we're talking, most women are in their 40s or 50s when these transitions are happening. That's when they're just really ramping up to take on the biggest role. And if we can educate the people that are working with them and the women of what's going on with their bodies and with themselves, and we synergistically make people understand we are not only going to save corporations money, we're going to retain the best talent and we're going to help move more women up through the corporate ladder so that less women feel like they have to hide or be ashamed of what's going on during this transition. And so that is something because I think it's important. I would say we want to educate the person it's happening to, but we have to educate the team around them so that we can be a best support as well. So this is not just a women's initiative, this is a people initiative.
I love that you said people initiative because to me, it's not doing a female ERG or, resource group. This is a company wide. It needs to be a company wide imperative because let's be honest, men in the workplace have wives, sisters, daughters, friends that are also going through this, whether it's someone on their team or someone that they work with. And so everyone, when we have an understanding, can start from that understanding to make the workplace not only feel inclusive, but also you're going to get better results, whether it's results from the employee or from the team. And is there something that you can do to more normalize the conversation? Because I feel like we're kind of in this like, I don't want to talk about it. I don't want to tell anybody that I can't remember anything right now. I'm having brain fog or whatever the symptom might be. What are some suggestions that you have to normalize the conversation? Hey, it's Natalie. I wanted to pop in and invite you to check out our programs, including Next to Lead AI and Next Career. If you're trying to figure out where to go and navigate next, we've got you covered at hercsuite.com. Check it out today.
That is one of the most important aspects of this because we shouldn't feel like we have to say, hey, this is what's going on in my medical life. This is what's going on, because that's a lot of pressure to put on the person in the moment. So, like you said, it's about educating the people around the person having this, where they just have that ability to say, hey, she's had a hard time today. Maybe we could say, hey, if you need to go to your office for this time, or if you need to go to a cool room, or hey, there's a fan around the corner I can go grab for you, so that you don't have to be the champion of your own medical history in a public space. Because it can be, like you said, it's uncomfortable. And a lot of people, and most people, don't feel comfortable talking about their medical history in the corporate structure. But if your boss or your manager or HR understands what's happening in this process, you don't have to. And they also know how to manage this without thinking, oh, she must be burning out. What's going on with her? And that background chatter that you don't want to happen behind you, where people are wondering, what is the problem? What is happening? She was working like this, and now she's not at the moment.
What kind of support systems, in addition to that, can you suggest to companies? I guess it would fall probably in the HR realm, but what can companies do to have a support system for women to find resources internally to say, okay, I am experiencing this. What should I do? Is there a way that I can do it without saying, like, hey, I'm going through menopause and that's why I just, can't remember what happened 3 seconds ago or whatever it is, right? What kind of resources would be helpful to both the employer and then to the employee?
First of all, something simple like in a public area or a lunch area, having a poster or an infogram that just explains, hey, this is menopause and these are the things going on. And that truthfully will just be a visual trigger to the person it's happening to and the people around them that these are normal things going on in that space. So just the education part. And then even maybe a QR code where they can go to here's the Menopause Society, or here's Selfority, or here's American Colleges of Obstetrics and Gynecology information on it. So they have some place to not only see it, but have a deeper dive on their own, or that significant other spouse that works there being like, oh, that sounds like somebody I know, and go forth. And then just in the back pocket, the easy things are having workplace adjustments that it doesn't have to be about menopause, but just workplace adjustments for anyone that just happens to help with menopause, like having the ability to be near a window if you need to be near a window, or having fans available in a back room that you can just pull out at need. Or lots of companies do this, but adjustable work hours. So if you haven't been sleeping, and this is a very common problem, if you have that 3 a.m. wake up that you can't go back to sleep after, you either are going to get up at 3 a.m. and work for 3 hours and then want to take a nap, or you're going to need to come in later. But if you kind of have those options laying out there, you're still going to get that 8 hours a day of work in. You're just going to do it on hours that work better for you. And then those are just a few of the accommodations that are don't take any money from the company, don't take any time away from you. And if you have them available, you're not having to ask for them, which makes you feel like you're out on a limb all alone.
I'm so glad you used the word accommodation because I think about our kids if they need extra time on taking tests or, there's all kinds of ways that we adjust for learning. But when it comes to women in the workplace, accommodations always feels like, well, why should we give her an accommodation and then not, anyone else? But the productivity and the ability for the company to thrive is better. So there's an economic reason to do it, and it's beneficial to everyone when there's that sensitivity.
Well, and you always want to think of the sensitive side. You want to support the woman, but you're right. It's a very huge company wide financial ramification when they start losing people and having to replace because either the person can't work and isn't working up to scale, or the person leaves because they think something's wrong with them and they go somewhere else because they're like, I'm not the same person here. I need to go somewhere else where I can start over. Or they retire early, which is financially hard on them and the company.
What are some conversation starters that you advise in the work that you're doing with your company to help women better articulate or be clear on the symptoms so that they can share, like, this is what I'm experiencing to hone in on, because it is complex. It isn't just, oh, I've got this stomach ache, so I'm going to, go get that fixed or whatever. It's so complicated. What are some things that she could be thinking about?
The first thing in either the personal life or her work life, and I always tell this to people, put yourself on the list. So if your child or significant other or your dog was having issues, you would be making a list saying date, time, what I did, what was the response to it. Do the same for yourself. Start keeping a log of what's going on with your symptoms. Have an idea of what you're working with. And then, just like any business meeting, if you have the information right there, you can be really productive about explaining it to someone, either to your HR saying, hey, this is what I'm going through. If you're in that private setting, this is what I'm going through. And I think it would be beneficial to all of us if I was able to work from home in these days of the week, or able to change my wardrobe at work because this nylon thing you have me in is I'm going to sweat through everything. Or if you're bringing this to your doctor's office, you have a list where you can say, like, hey, this is happening. These are the things I'm worried about. That way you're presenting, just like you would at a business meeting, presenting your plan to them, and they can easily be like, oh, yeah, that makes sense. Let's move to this stage. Instead of y'all having to do this kind of, well, have you had hot flashes? Have you had night sweats? How often do that happen? And you're like, maybe. And that way, you're prepared. And when you can talk about what's going on and you can talk about it easily and persuasively, just like in any business, you're going to get the best results. So I would say prepare for a doctor appointment just like you prepare for that business meeting.
Yeah, absolutely. Absolutely. And I know that we talked about this, but that's the work that Her Health X, my nonprofit, is going to be doing, is helping women prepare. And actually, menopause is one of the disease states that we wanted to start with because it does affect menopause and perimenopause, because it does affect women. It is so comprehensive, and it has a trickle effect or a ripple effect into all these other areas of our health, which is so important. As we think about the future, and you've said that you're going to be working on the workplace, what are some things that you're really excited about that are either initiatives or education that you're working on that you can't wait to see come to fruition?
Oh gosh, I'm excited about everything. If you've ever met me, I just really enjoy bringing information to people everywhere. So I am excited to expose people to this education that I have through my course so women can learn in their own private space about what's going on with their body. And I am excited about this initiative to bring it to the workplace. And I'm doing some work through organizations like Women's Health Advocacy to think about the legislative changes we can do to make this bigger and to make it where it's not that whispered conversation, because I know how uncomfortable many women are because we put shame and ageism around the idea of perimenopause and menopause. So, one of my missions in life is really bringing people into the idea that this is a stage, it is not forever. And we have a beautiful life, and 30 to 40% of it is after this transition. So, this is not a stop. This is a transition to our next self.
Yeah, next best self. Because women really, once you're through it, you're like, wow, this is fantastic. I feel so good. But there's the middle, the messy middle of it that takes a little bit of time.
And to not disregard, like, we don't tell people how long the process is. And for most people, it's 7 to 10 years. So this isn't something like, some people hate being pregnant, but they know it's 9 months and then it's on the other end. This isn't a 9 month, this isn't a 1 month, this isn't a 1 week. So getting support, the earlier the better, because it doesn't have to be terrible. Just like all the jokes are out there, we can do things. There's so many avenues of care. And if you ask for it, you'll likely find it.
It's so good to know. And also, I didn't realize 7 to 10. I mean, that is a long time. It's not a short time. So we're experiencing this progressively and going up and down. And that does impact our work productivity and everything else in a big way. So that is a number that anyone that's in the middle of that or 2 years in, you have hope. There's another side. But during that time, is there something that you have found to be really helpful as women are going through it, that I don't know if it's meditation or what are some things that you advise your patients on, of things to try to give yourself more time for sleep? Or I'm making these things up, but what do you advise?
One of my biggest advice is we are not one size fits all. So you are not your best friend who went through it this way, or the closest person would be your mother. You're probably the most like your mother. It's a hard thing to say someone else's journey will be your own. And I think that's why I'm so excited about the education I can bring because it's just giving you an array. And it's starting point where you feel comfortable. Some women say, no way to hormones, but maybe when they learn about them and they learn about what they do and what they don't do, they may feel more comfortable because most symptoms will improve with hormonal therapy. But understandably, some people cannot be on it and some people are not comfortable. And so there are a lot of non hormonal things you can do besides grit and bear it. And like you said, meditation, there's cognitive behavioral therapy, there are a lot of over the counter not medications, lubrications and ointments that can be helpful. But again, be very careful because the world out there is going to try to sell you a lot of pink labeled menopause products that truthfully probably won't do a lot of anything but make your pocketbook leaner. And so it's really important to make sure that it's something that has some evidence behind it, which is again why I do all this work so I can give you the evidence. And then physically active and eating well and how you eat and when you eat are very important, not just to look healthy, but to be healthy on the inside. And persons that really think, and again, putting yourself on the list, taking care of yourself, not just because exercise makes me feel better, but exercise has longevity effects that we could go on for hours talking about. Nutrition and not depriving, but eating in the way that you're really getting, I call it the colors of the rainbow. So the Mediterranean eating idea or the dash eating idea, I try to avoid the word diet because these are not diets. These are eating ways are really beneficial. And one thing people don't love to hear, but it's true, is alcohol can make a lot of the symptoms worse. And so I will never tell you you can't have your glass of wine or your mixed drink. Again, when you're keeping that log, watch what happens after you have a glass of wine and see how your sleep does. And then maybe go a couple weeks without doing it and see if it's different. And so it might be worth modifying some of your life habits to make this process a little easier on you.
Yeah, I'll just comment on that from personal experience and why I don't drink anymore ever and not because I had any reason to other than I experienced what you're talking about because it can boost your estrogen. I know this for myself. The next day I felt like I was going crazy and I was like what is happening? And it's this surge of hormone change that can happen for some people. I don't know if it happens for everybody, but for me, I just thought, I don't like how I'm feeling right now. This is making me feel really anxious and weird. And you don't realize that the cause of that, once you take it away, it's like, oh, I don't have that feeling anymore. That's easy to not do and find something else. So I just want to encourage people to play around with it and experiment, right? It's an experiment to see what works and what's not working.
Exactly. And overall, most people in this stage do feel better if they can avoid it. But again, it's just knowledge, it's just information.
Yes, yes. It's not for everybody what I'm describing. I'm just sharing my own personal perspective on it. So I love this conversation. If people want to know more and get educated with all the things you're doing, where is the best place, Dr. Berg, for them to find you?
So, a couple different locations. One is my website where my platform lives. So, it's selfority.com. And that name is because your priority is yourself. So, Selfority, like I speak about a lot. So, I'm on Instagram, I'm on Facebook under that name. I'm on LinkedIn under my name, and then I have a company page. And then I write a lot. So I write in Katie Couric and on Bioscience, on parents.com. And I attach a lot of that to my Substack. So again, Sarah Berg, you can look me up there and you'll find some of this information. And I do a lot of speaking. So I'm trying to spread the word. And I love being able to talk with amazing people like you because I know that you and I are speaking the same language. We just want to encourage women in this stage to do what they can to feel their best selves.
So good. I could talk to you all day. It's so hard to say goodbye.
Same.
Well, we'll stay in touch because Women's Health Advocates is amazing. I love the organization, and that's how we connected. I was like, "Oh, who are you? Let me talk to you." And I'm like sending you a message. So, shout out to Liz Powell for connecting us, and thank you so much for the chance to talk with you today. I appreciate you.
Thank you for bringing me on, and thank you for helping share with all the people that listen and caring about them enough to bring this message to them.
Thank you for spending your time with us today. This is a podcast I want to ask you to share not with one, but two friends, because the topic is so important. Our health is everything. When we feel our best, everything else goes smoothly around us. Share it with a friend or colleague, and I would love it if you would rate and review the show. It's how others find us. Remember to keep shining your light bright. The world needs you.